Michigan Medicine strives to be a safe, welcoming place for transgender individuals and to provide excellent health care regardless of gender. The goal of this video is to improve the comfort and competency of frontline staff in caring for transgender individuals. We will start by talking about gender identity, challenges the transgender community has faced in the healthcare system, and Michigan's policies regarding gender non-discrimination. The second half of this training is job-specific. In order to discuss gender identity, it is important to understand the difference between sex and gender. Sex refers to one's reproductive organs, native hormones, and chromosomes, while gender identity refers to one's internal sense of gender, a person's basic sense of being a man or boy, a woman or girl, or another gender. Gender identity can be expressed by how individuals present themselves socially, including clothing, physical characteristics, speech, and mannerisms. All people, whether they are transgender or cisgender, meaning not transgender, have a gender identity and expression. Transgender is a term for individuals whose gender identity differs from the gender identity typically associated with their sex assigned at birth. There are many identities that fall under the umbrella of transgender. Transgender men, trans men, or transmasculine refer to people who are assigned female sex at birth but identify as men or masculine. Transgender women, trans women, or trans feminine refer to people who were assigned male sex at birth but identify as women or feminine. Other individuals may identify as genderqueer, agender, gender fluid, two-spirited, bigender, or another identity that does not fit neatly into the categories of men or women. All major American medical societies, including the American Medical Association and American Psychological Association, endorse gender-affirming care as the standard of care for transgender individuals. This means caring for people in a way that supports their gender transition and gender identity. Transgender people may undergo any one of a number of gender-affirming medical interventions, including hormonal therapies like estrogen, testosterone, or hormone blockers, and surgical treatment to change body contours or genitalia. However, it is important to note that one does not have to undergo any medical or surgical treatment to be transgender. Some people are easily read as the gender they affirm, while others are visibly gender nonconforming or androgynous appearing. Beyond gender, people who identify as transgender are diverse. They span all races, socioeconomic statuses, urban and rural settings, ages, sexualities, etc. Research done right here at Michigan Medicine suggests that between 0.5 and 1% of U.S. adults identify as transgender. At Michigan Medicine, we care for patients, welcome visitors and families, and employ staff members who are transgender. Some Michigan Medicine patients who are transgender coordinate their care through the University of Michigan Comprehensive Gender Services Program. While some medical aspects of gender-affirming care are specific to certain specialties or clinics, trans patients receive care across the health system for routine and emergency medical concerns unrelated to their transgender status. Given historical marginalization and experiences of violence and discrimination, transgender individuals may enter the health system with a heightened sense of fear. A quarter of transgender individuals report delaying seeking medical care due to fear of discrimination. Even after working up the courage and means to access care, transgender individuals face significant barriers. In 2011, a national survey found that 19% of transgender individuals were denied health care by a provider because of their gender identity. 28% reported verbal harassment in the medical setting, and 2% were victims of violence while in a medical office. As one transgender individual described, "Denial of health care by doctors is the most pressing problem for me. Finding doctors that will treat, will prescribe, and will even look at you like a human being rather than a thing has been problematic. Patients deserve better than this, and we as a healthcare system are committed to ensuring all patients, including transgender individuals, receive excellent care." The University of Michigan has a comprehensive non-discrimination policy and does not discriminate against individuals on the basis of race, color, national origin, age, disability, sex, sexual orientation, gender identity, gender expression, religion, marital status, or any other legally protected basis. The second half of this training is job-specific. The goal is to help you put Michigan's non-discrimination policy into action by giving you tools to ensure that Michigan medicine is a safe and welcoming place for people of all genders to seek care.